Okay, saying all of this for the first time. Good morning, everyone. So
Morning.
before we move on, we're going to talk. Oh, there's Waskar. Good, he didn't miss much. We're going to talk a bit about the course material from the LMS. So the scene opens and we see our good friend Latavia, who we know from previous training, and there's Barbara, and she is providing supervision for a case planner. Does anyone remember the very first thing we learn about what's going on with this case planner? Anyone recall?
It was running late.
Running late.
Yeah, she was running late, right? People have experienced this before where folks are running late to supervision. There's always a million things going on. How does the supervisor respond to this case planner's lateness?
She addressed it in a way that allowed the case planner to understand that the supervision is an important part of the process, but she did it in a very non-judgmental and supportive way, allowing the case planner to understand that this is how case planner eventually will be able to use this style with her families who are difficult or not engaging at all times. I'm just like, it's part of the parallel process.
Yeah, absolutely, right? She was able to hold the case planner accountable without any sense of like, why were you late? You're always late for supervision. You're such a terrible case planner. So we're already seeing some of this parallel process ways to hold staff accountable without making them feel embarrassed or ashamed or like they, are doing something horribly wrong. What are the other tactics that we saw the supervisor use to address the lateness? What else did she bring up? So if we recall, she kind of used her sense of humor a little bit. So you know what, if this is going to be a thing, we might have to come up with a whole plan for the unit, right? It was very free of the notion that this was a shame or blame kind of dynamic that they were going to use to navigate how they're going to resolve the lateness. From the conversation about lateness, the supervisor is able to pretty seamlessly transition into a conversation about the work, not really dwelling on the fact that the case planner was a few minutes late. So case planner worker comes in and immediately starts throwing issues at the supervisor. This family is this, they're that, they're that. How does the supervisor redirect this conversation? If we can recall, how does the supervisor redirect the conversation?
She said to her, you are jumping to the third milestone or something like this, and then tried to redirect her to where she wanted her to be.
Yeah, she definitely has the case worker reel it in a little bit. We're jumping. Slow down. Yeah, let's pump the brakes here a little bit. And she actually says, we're coming in here and talking about the old ways of doing things. And I'm sure you know more about this family, right? Redirecting it to be a more strengths-based conversation. And what else do we know about this family besides the laundry list that you're throwing at me of things that they're doing wrong? Then they move into a conversation about building consensus, and with very little formality, the supervisor is providing some of the ongoing education about the model that we spoke about last week, the fidelity to the model. Does anyone recall how she does this? They're having a conversation about supervision, if that's helpful. So she's asking the case planner to bring up the tracking questions that she asked around the family level of consensus, right? So the supervisor asks, on what level have we reached consensus? And the case planner says family, because they're talking about supervision. Supervision is a family level issue. So with just those small cues, the supervisor in this situation is communicating that SBC, the outcomes, the plan, these are things we're going to talk about in supervision. As supervision goes, so goes the casework, right? If this is a supervisor who is consistently speaking the SBC language in supervision, what does the case planner know?
That it's important.
That it's important, right? And that my supervisor is going to ask me about this. So I might as well be doing the work because I know my supervisor is going to want to have this conversation when we meet for supervision. The same predictability and consistency that we are expecting parents to provide for their children, we as supervisors, directors must provide that same predictability and consistency for our workers. Any questions about anything I'm saying so far? Okay. From the conversation about supervision, they then move into a conversation about nutrition. What do we learn about this nutrition piece?
It's like the children went to the neighbor's home and said that they were hungry because the neighbor used to give them sweets.
Yeah,
So
right.
this is a way of them getting sweet. It's not like they were really hungry because the refrigerator was full with good food and stuff like that.
Yep, we learned the kids are bamboozling their neighbor into giving them sweets, and it's not necessarily a safety concern. But what can we tell? What has the case planner done to get this information? What SBC skills has she used? How do we learn information about families? What's the SBC skill? Hear you, but I read your lips and you said tracking, Lunas. Yeah, right. We can see that the case planner has done the work to figure out what is actually going on, because it's easy to say, oh, well, the neighbor said the kids are hungry, but we can jump to the conclusion because that's a big, big deal. Hungry kids, not ideal, right? So, but if we have done the tracking to figure out more of the context behind the situation, we're able to see what the clear picture is. And we also learn, as Marie said, that the case planner checked the fridge. The fridge was stocked. She spoke to the kids were giggling during the conversation. And we learned that these are tiny little con artists who are just going next door to get sweets from their neighbor. Tracking. The case planner has done a good amount of tracking around this issue. We also see another brief moment, reminder of model fidelity here, when the supervisor gives the case planner directive to include this information in a specific portion of the progress note. The kids being hungry is around child safety. So whatever the template guidelines are for your documentation, we want to finesse this kind of conversation into a piece about safety. As supervision goes, so goes the casework, and we all know that documentation is part of casework. The case planner and the supervisor then move on to a conversation about drug use. And the case planner says, I don't believe it was a factor that day. I don't believe Mrs. So-and-so's drug use was a factor that day. If I am a case planner and I come to you in supervision and I'm like, well, I don't think it was a factor that day. What does that tell you as a supervisor?
It's an assumption that needs to be, more information needs to be gathered around it. This is something that we don't know for a fact. How is it? We need to get more tracking around the issue. We cannot normalize substance use. We need to gather more information around it.
Yep. Any other thoughts? Oh, Robert, if you're talking to us, you're muted, my friend.
Case planner might be
minimizing this, which is of concern.
We just haven't done enough assessment yet to figure out what the deal is. I think it's cold outside today, but I also haven't stepped out of my apartment. I haven't done my research to figure out what the weather is outside. So I could tell you what I think is going on, but I really don't have any idea. We need to do much more assessment, build consensus around the outcome before we're able to label it as an issue. We're not going to normalize the drug.
I wanted to say
Yeah,
our workers should also, I guess they could learn what to look for when they're looking for illicit drug use, because some people don't recognize, some drugs have different type of indications on an individual, like marijuana. A person smoking marijuana won't necessarily behave like a person that's drinking and taking other drugs. So they need to know what to look for, in that person. Because, they can have glassy eyes, but the worker, if they don't know what the indications are of drug use, they won't know how to recognize that.
Right. And this absolutely, and that comes with more training and education. This might be a controversial statement, but as a parent drinking and then forgetting to pick their kid up from school or take them to doctor's appointments, or our parents having a couple glasses of wine on a Friday night while the kids are either asleep or with a babysitter. We must find out the context around the substance abuse before we can even label it abuse, right? We're not saying, oh, this parent had a glass of red wine at the end of the week, therefore they are an alcoholic. We must do more tracking to figure out the degree to which and the context in which adults in the home are using substances.
Even if we've gotten from ACS, like when the case comes in, when we've gotten on that referral information that they did a drug test and they tested positive for certain drugs. So I'm asking, even if we get the referral, which indicates that the person has been using drugs over a period of time and that ACS had a test taken and the test results came back, the toxicology came back positive. So we have that to go on as well. So or are we going to just pick it up from when we start?
What are our thoughts about this? I'm curious what folks have to say about this.
So it's both. So if we have a referral where it says that the parent or caretaker is positive for certain drugs, we want to know what services are in place to continue to monitor that. And then we need to continue to monitor that. But we also need to ask questions about if they're using when, around what, it's very tricky because now we have lots of clients who literally have a medical marijuana card. We can't tell them they cannot use marijuana as prescribed because that is literally part of their treatment plan at this point, right? And we have a lot of clients who are taking pain medication and so it will show up. So we need to ask really clear questions to the providers, and that's where the collaterals come in play. But we also get referrals where it says parent tested positive in October. All right, well, we're in January. So a lot of things could have happened and the story could be totally different. So we need to ask all those questions.
Okay.
Any other thoughts about what Barbara is posing here? Because I think it's a very good point.
The only concern, I just wanted to add, the only concern I have regarding, it's a little slippery because if we get a referral and they've taken a test showing positive, we don't really have a way of monitoring that, because sometimes some drug use you can't see, but it shows up in the toxicology. So once ACS is out, we can't really continue with the random testing because we don't do that.
Right, but we also get where it's positive, but the children were not in danger. And so it's like, we have to know that information because if the parent used recreational and illegal drugs, but the children were with the grandparents and were not at risk, those are very different things, right? Because then it's a parent, while they were engaged in illegal activity, and we will need to address that, they didn't put their kids in danger. So I think it's like, this is where SBC really will help us because we have to track, because we have to ask those questions and, really get to know where they're at. And if ACS is asking for drug testing, Especially now, we need their partnership in that, because once they dip out, if it's not a mandated service, it's even right now, like the clinic downstairs doesn't drug test. We can't find a drug test for people. So it is difficult, but we need to ask all those questions and put it back on ACS at the joint home visit.
Yeah, because we are FTR and we do monitor these intensive issues like substance abuse, mental health. So I was just thinking or wondering if we had something to fall back on, because, like, I know for a fact though that ACS, I mean, if we cannot connect the parents' drug use to their parenting, then nothing should be done because it's not impacting that. So it's really very slippery, but
I would also,
I guess with correct assessments, we can do it.
I would also argue that even if a parent is using drugs and leaving a child with a babysitter, in the long term, that is going to impact their parenting. So we're not just going to say like, all right, well, the kids were with a babysitter. It's all good. It's all good here. We want to provide what the long-term consequences of that might provide education on what the long-term consequences of that might be, while recognizing this is not immediate or impending safety concern. And that's the best we can do. Questions, feedback, pushback so far? Great. Tracking. So after we see our old friend Latavia meeting with the first case planner who arrived a couple minutes late to supervision, we see her meet with another case planner who is much more seasoned, and he's struggling with having the family build consensus. Have we worked with case planners who struggle with / want to have 100% consensus from 100% of the family 100% of the time? We need everyone to be on the same page. We need a high degree of self-awareness from all caregivers to admit that they are part of the problem and identify how they're contributing to this dynamic. We've had this before, so a couple nods here and there. How do we help folks through this? All right, I'm a case planner. If I can't help a family come to consensus, I must be a terrible case planner, right?
I think as they did in the video module is being able to identify what we could agree on, develop partial consensus on some of the aspects that led to ACS or child welfare involvement, allowing parents to agree to certain things, and then from that point on, explore others, and eventually get a buy-in. It's not a one-step process, it's a multi-step process. That would allow us to do that.
Mm-hmm.
Yeah, you got to take what you can in the moment and hopefully be able to build.
Yeah.
So you know what that reminds me of? That reminds me of in social work school, the professor saying you're not going to be able to help everybody. So if you have, it's good that you have high expectations, but if you think that you're going to be able to do 100% consensus with every family, that's not a good place to be at, because it's almost impossible. Not to say you give up hope, but those expectations are a little bit unreasonable.
Yeah, you're setting yourself up for disappointment if you think you're going to come here and like change everything all at once. It reminds me of the starfish poem that starfish story that we talked about in our leadership meeting yesterday, which I will happily share with you all after this. Yeah, we're opening the door to have the conversation about consensus, right? We have to understand that folks that we're working with, families that we're working with have been, a lot of the issues that they are experiencing have become normalized because they were not all of a sudden issues when ACS became involved. So by opening the door to building consensus, recognizing that there is an issue, that's beautiful, right? We don't need to have 100% consensus 100% of the time from 100% of the family.
I think that some of the challenges sometimes with some of the case planners, especially the newer ones, is working with families and trying to figure out how to have them be willing to open the door.
Mhm.
You know, that then becomes a big challenge because, okay, you know, well, looking at consensus, it's like, well, you know, I don't see this. You know, it's like the vacuum cleaner salesman thing. It's like, if I can just get my foot in the door, maybe, you know, maybe. But that requires time, patience, and more patience because it's not going to work out the way that you want it to work out initially.
Mhm. Mhm. What are some tips that you can recommend for clients who just don't want to have the conversation about the issue? We talk a lot about like resistant clients and stuff like that, right? How do we open the door? How do we get the key fitted? How do we go to the locksmith to get the key for the door?
I think
Have to,
one of the,
all right, so we'll have to utilize our engagement skills a lot there.
Mhm.
You know, and as I think I said it last week, it's, of course, we're going to have respect, be genuine, and empathy. And you work with the client there, and if they don't want to talk about it right then, you're just formulating like a relationship, so that can come somewhere down the line, hopefully not too far.
Yeah, I think if I am a client and I have someone come in who all of a sudden wants to talk about, you know, my ACS involvement, because we understand that could be a traumatic experience for folks, ACS coming in, asking you all these personal questions and your business and stuff like that. And that's the first and only thing you want to talk to me about. Goodbye, see you later, not interested in this conversation. But if you are warm, compassionate, non-judgmental, and perhaps maybe even ask me about things that I want to talk about, I'm much more likely to entertain the notion of having the conversation about some of those deal breakers.
You need to get a sense of the emotional landscape
Mm-hmm.
that you're going to be able to really navigate the terrain.
Mm-hmm.
It, you know, if you don't have a sense of what it's going on in the map, you're going to get lost. And I know I'm throwing a whole truckload of metaphors out there, but
Yeah, building trust, right? If I do not trust you, and I don't mean like that you're not going to go, you know, tell my information to people. If I am going to give you this part of myself and I can't trust that you're going to hold that part of me with safety and containment, compassion and care, it's not going to happen. It's simply not going to happen.
So that's like in the beginning,
Mm-hmm.
when you're formulating that relationship or that trust, but you cannot lose sight of why you're there.
Mm-hmm.
Because I've seen some workers get lost. Like, in other words, they're visiting the client, they're talking about things that have nothing to do with why the case was referred, and they lose the whole purpose of them being there. So that can't or shouldn't go on for too long.
Mm-hmm.
So you have to have a medium with that. You know, what is, you know, how long should I spend or can I spend on formulating this relationship? And when is the time for me to really get in and start talking about the issues?
Right. All of a sudden we have case planners who are being invited to family reunions and weddings because they're not actually
Yeah, exactly.
their hand, right? They're
I says, well, listen, based on the note that I just read, you know, the last few notes is like you're there like for a social visit. You can visit your relatives on a weekend with that. We need to get to more of it. Yeah.
Yeah. Yep. I'm picking up what you're putting down, Barbara. And then we have case planners who want to keep easy cases, right? Because they've developed this rapport with the family. They know they're not going to go all the way over there and not be let in the home. The clients, you know, the clients are going to show up. We've created too much consistency and predictability at that point. Just kidding. Any other thoughts about the course material? We'll review the documentation stuff towards the end of the webinar. And I must admit, I forgot something from last week. But any other questions about the supervisory sessions that we observed in the course material in the LMS? Great. Let's shift our conversation a little bit to talk about the FTC. So all of the FTC facilitators have also been trained in SBC. As supervisors, what's our perspective, supervisors, directors, what's our perspective on how solution-based casework fits into the FTC? And what's the importance of using the model in FTCs?
I have a question, Maria.
Sure.
So are the FTC facilitator trained at another training? Because I don't see Raina here and I'm wondering.
Yep, so Raina did the initial training.
And FTC facilitation.
So I don't know if she's done the FTC facilitator training, but all of the FTC facilitators did the initial SBC training last month.
No. I thought that they were getting a special training to facilitate using SBC.
No.
Oh, okay.
Nope, so it's the same integrated model that has been in use. How do we infuse SBC into the existing model of FTC, too many acronyms, of FTC facilitation?
When we're asking the family
thinking,
what brought them to services, oh, I'm sorry, someone's talking.
Justine, you go first, and then Marie, I'll come to you.
You know, we're asking for their perspective, and we can make sure that we have the partnership there, right? And you know, when we're discussing like the concerns, we're reiterating that whenever we're talking about concerns, we're going to have a plan around this. It's really like the setup for the shot to do the family agreement. We're getting consensus, and the facilitator really needs to wrap the consensus up in a bow if it's not there. Because when we're putting the plan, it has to be based around the issue, and the facilitator can frame it in the ILO, FLO, which we're going to see then incorporated into the FASP. So it's really helping to bridge the gap. So the facilitator has like a really important role because they're really shaping that consensus if it's not already there.
So we're seeing how the model is being integrated at all different levels and how all of those levels inform the next level. The casework informs the FTC, informs the FASP, and it all informs supervision.
I think
Marie, I'll come to you.
the most important thing really, what Justine was saying is that, you know, you're getting the consensus or agreement because the families are the experts of their life. And if you're giving them that power, it should, you know, pretty much work out well because you're not taking away from them. And I kind of struggled with that a little bit because in cases where there's court-ordered supervision, how does that really fit in? Because the court, you know, the jurisdiction of the court overrules it all. I mean, all of our cases are not court-ordered supervision, but I just always wondered how that would work with the court being involved because that kind of takes out that the humanity, so to speak.
Both Justin and Bob were touching what I was going to say. I think since we do an initial planning conference, so the conversation on building consensus starts at the initial level, initial planning conference. And then as you moving along to the FTC in 5 months, you can just start talking about the family agreement, start integrating the strength of the family, based on the family agreement form that we have here. Yeah, I think it's doable.
So talk to me about how FTC facilitators get supervision. What's the expectation for FTC facilitator supervision?
I supervise the FTC facilitator at Surfside. My conversation since she completed I think she did the SBC before last year. And after the initial SBC initial training, we started having conversation how to integrate pieces of SBC into the FTC facilitation meeting. So it's a process, she's getting it. And then we're having conversation about the interviewing skills from normalization, even though she probably is not going to go all deep into the interviewing skill, but this is something that she can build on when she's doing the FTC.
Mary and I are sharing the responsibility because the other supervisors are carrying a case aid. And, you know, but I think what we're doing is like, because, you know, there are 4 units and it's like a facilitator per 2 units, that there's like a debriefing with the supervisor that's holding the conference, because they really could talk about that case as opposed to me or Neri, who might, you know, I have some understanding, but I'm not going to know all the nuances of the case. And then we're meeting on like a monthly basis to like really like sit down as a team to talk about like FTC facilitator needs, what we're seeing, because there's so many staff and players, like a lot of things come up that like we sort of need to work through. And so that's sort of how we've been doing it now. We also, you know, started off pretty slow in terms of cases. So I think we're finding out the footing. So I'm curious to know what other programs are doing, because maybe we could incorporate some more of that stuff as well. But that's sort of how we're doing it now in FTR.
So Marie, I think that the FTC facilitator, we were talking about, you know, what their function should be. I think it should be to try to the best of the ability to keep the group focused and productive and to redirect, because that's needed a lot. A lot of people, like, you ask them one question, they want to tell you the whole history of life, right? You know, and, you know, you don't want to cut people off and be rude, but that FTC facilitator, I think, should be responsible for redirecting and, you know, keeping everything focused. And sometimes I don't think that happens. I think it's because there's like, you don't want to be rude, right? And interrupt someone when they're speaking. But as the facilitator, you got to find a way. I don't know what the way is either. Find a way to keep that, you know, within rounds.
I meet with the FTC facilitator as often as I meet with the supervisor. And, you know, we go over what is new. We talk about the language that is used in the documentation, which is very important because we do great at FTC, you know, making sure they all done, but in the end, it boils down to whatever ACS find in the progress notes when we have a pen review. So I think it's very important to document and follow whatever they're looking for, because, you know, no matter how much we kill ourselves for doing all this FTC, if they don't find the right documentation when they review them, we're still going to get a low score. So that's something that we struggle with for a very long time. And of course, you know, I only have Raina now as a facilitator. She's really good about the FTC. So just trying to integrate,
Right.
you know, the SBC within what we had before and what is expected of ACS at the same time.
So what are we telling? So I understand the expectation. I understand, like, for some programs, director is a supervisor. For some programs, it's more of a shared responsibility. But how are we preparing? Maybe this question was answered already. I'll ask it again. How are we concretely preparing our facilitators to use these skills in the actual conferences? Because Barbara, I think you raise a good point here. I think that especially when there's someone new, you know, our clients are not seeing the FTC facilitators as often as they're seeing the case planners. There could be a temptation to, you know, word vomit, just like get everything out on the table. How are we walking facilitators through reeling it in and staying focused? Because that sounds like a common value that everyone has, is that we want the conferences to stay focused and be productive.
I think one of the ways that we started doing it is supervisors usually are present for initial conferences, which allows facilitators to understand the family. So with us being present there, we help to guide the case in a specific direction. Because the facilitators become aware of the case, the following conference becomes a little bit easier to understand, which it becomes gradual progression. So they begin to understand what needs to progress from one conference to another conference. And that's how I think we do it,
Mm-hmm.
to help them out and make sure that they stay on task. Yes, sometimes during the conference, you would see the family trying to go on tangent, and then facilitator attempts to bring it back, may not be successful. Then as supervisors, you'll be able to kind of show like other skills, how to stop the family, ground the family, and go back, normalize what they're saying, acknowledge what they're sharing during the conference, and go back to the original conversation discussing the issues at hand. So that allows progression.
Neri, and you found it beneficial to have the, and this is a question for everyone, not just Neri, but Neri just spoke, so I'm addressing him. It has been beneficial to have the supervisors there to lay the foundation, set the tone, and stuff.
At least for initial conference.
Yeah.
Yes,
At least-
I agree. Yeah, I've been doing that with every new family that's come to us. I sit in the initial conference, and there have been times when we've had conferences via Zoom, you know, because the facilitator was new. I would shoot her a private message in Zoom if the meeting was taking place during Zoom, and say, okay, you need to rein this in. You need to address this. Let's focus on this. Because I didn't want to be facilitating the conference. That wasn't my role. I mean, if need be, in case of emergency, break glass, yes, I could have stepped in, but it was her role, which she did and continues to do well. So, but that's helped. It's a little bit more challenging in, let's say, WhatsApp or Google Duo, but the good thing about it is that we'll talk about these families and where they're coming from prior to and brief afterwards as well.
Yes.
So extremely helpful. And then that sets the foundation for the planning conference, where 9 out of 10 times I'm not present unless there's a specific reason where, okay, you know what, this one I need to sit in on because this is going on. But other than that, that's pretty much how, you know, from my end, how I've been handling the relationship with our SBC facilitator.
I agree.
A lot of nodding when you said the private message, when you made the plan.
I think that the supervisor should definitely sit in the initial planning conference because it's a great opportunity for them to learn the case, for them to learn the plan, to become familiar with what is going on, and then as they, you know, supervise the case plan to move forward. And it's a lot easier for you to remember as a supervisor when you learn about the family from the beginning and what is going on. It's a great opportunity for the supervisor.
The family also has the opportunity to see who you are as planner, and you can also set tone too, in terms of this, and this.
Right. Once you see the family yourself also, when you're providing supervision to the supervisor, then you remember what the family is about and what is going on. You're able to make your own assessment just by, even if it's a virtual conference, you know, you remember everything about you. You look at the family and with the experience that you have, you could just make your own assessment right there.
So yeah, I agree with Maria. Definitely we do that. Like for initial planning conference, we sit at the initial planning conference. Is very also helpful when you write your, I mean, we have to write the supervisory review within 2 weeks, but then the one has more meat, the one, you have most of the information after the initial planning conference. However, when we have, example, if there's FTC scheduled, now we only have Ray now, but we used to have 2 FTC facilitators. I do meet via phone, or I have a conversation with the FTC facilitator about the case and what's the concerns and what the family is doing, because there's a lot of cases. So FTC facilitator needs more information in addition getting information from the case planner. And also there's unfortunately some case planners that, they have a relationship with the family and they are like, so a supervisor sometimes, I'm not saying they know the family better, but they know that relationship, and sometimes they bring other concerns that sometimes case planner, keep them. So I think that helps too. Meeting with the FTC facilitator, just having a conversation prior to the FTC. If the supervisor is not going to sit, even if you're going to sit at the, at the conference.
And also sometimes they're very difficult families, and that's when,
Mhm.
I think you should sit at this
Yes.
conference too, because it looked like, it's a very challenging situation, the decisions that need to be made. And sometimes a case planner don't have that assertiveness of saying, no, we, stand up and say, we don't do this. I'm really concerned about that. And the supervisor definitely intervene.
So we're bringing up a lot here. We're talking about supervision of the FTC facilitator and infusing opportunities to have the SBC conversation in supervision as it stands. I'm hearing that there's also a debriefing process post FTC, which feels like another opportunity to see, how did things go, like our glows and our grows, that kind of stuff.
FTR has a slight advantage of having CDTs. So like everyone who's involved in a family is introduced to the family, you know what I mean, within 30 days. So we're having a discussion, we're guiding it from the beginning as the FTR team, and the facilitator is a part of that. So they already know what the consensus should be at that first meeting. And so when we go back to case conference, which will be part of our unit meetings, right? I'm wondering if something might be helpful is like when we're, for the other programs that don't have those, it's just so many meetings, but like thinking about how to do like a mini case conference to introduce the families, because I think sometimes when the first time we're talking about a family as a program or a team, if it's months down the line, you're missing you're missing an opportunity, in my opinion. And I think that's something that happened, the last go around is like, we're having a case conference and sometimes we would focus on early cases, which helps set the tone. But if we're talking about some of the older cases, it's almost like it's a different mind shift. And I don't know if anybody else feels that way, but it's just something as we're talking that I'm thinking about now, like the things that we've been trying to carry on, even though it wasn't a priority, and the things we need to bring back.
I think for some of the older cases or challenging cases, I usually have a meeting with the FTC facilitator prior to the conference. Or the FTC facilitator will call me because I encourage her to read the case before she sits in a conference. So she will say, okay, this is what I see. What do you? So we usually do a brief before the debriefing in supervision. So I find it interesting. So we can talk about the case. At time I said, okay, see the supervisor on this issue before you sit in the FTC training, because you don't want to sit in a conference where you know nothing about the case, or maybe 10% about the case. You need to sit in a conference to have an idea about where the supervisor is coming from, what are the concerns that the supervisor is seeing. So that's why many challenging cases, I sit down with the with the FTC facilitator before the conference, and we talked about it.
I will, Maria, I will definitely say, yes, publicly, Emily has done a great job with that in terms of not only reading the record, but then reaching out to me, reaching out to the worker, then possibly even if time permits, having a meeting with the both of us prior to having that meeting with the family. So, I mean, she's done an excellent job with that.
Yeah.
Adelina.
Yes, also our facilitator, Reina, you know, she's great. And prior to the meeting, she makes sure that she reads the last supervisory review note, the last FASP, and also the notes. And she also reaches out to me if I forget to reach out to her, because she sends emails. You know, we are aware when the FTC is taking place. So she's prepared. She knows, you know, family's name. She calls them by name. You know, it's not like just a stranger sitting there knowing nothing. So yeah, she always prepares before the FTC, and I think that's very helpful.
Of course, you need to know what's the family background, why the case,
Exactly.
what has been going on, you know.
Culture, everything.
Exactly, and the workers too. They have an initial planning conference. They need to read. They need to learn as much as they can about the case before they sit there. Otherwise, they're not going to be as productive.
Exactly.
Read the initial. If they have a comprehensive, read the comprehensive. Read the notes. See what the previous supervisory notes on ACS. They should read. You know, if the case, the investigation is there, you know, try to get as much as they can so that they be prepared.
Well, I think this goes back to one of the things that we've said before collectively in terms of, and I'm just using my own words, is that our case planners are our eyes, essentially, to the families. You know, their lenses will be focused based upon how we instruct them, you know, in terms of what to see, you know, how to view it, you know, how to truly be objective about something. And then really just breaking that down in terms of, you know, what needs to happen when, you know, but, and this then ultimately gets transcribed, you know, and that then becomes another skill level. You know, some do it far better than others, but they are our eyes in terms of what we ultimately see that's documented.
It's a very unique position to be in as an FTC facilitator. You have to have the strongest engagement skills, build that rapport so quickly to have, because you're a stranger to families, to build that trust on, you know, on the fly like that. I imagine is a very tall order. Other thoughts about prepping case planners to use and case planners and FTC facilitators to use SBC during the FTC?
I think it's very important before family has an FTC that they actually prepare for the FTC so that they are open, that they understand the purpose of the FTC, and that they can also understand that they take advantage of it, that this is their opportunity to talk about what is going on with the family, to express themselves, to say what they really want, to say what are their concern, because they may be totally different than the concern that we have. And to a meeting in which, you know, we could balance the situation so that the family is not just sitting there, whatever we attend, so that they're more of a participant and that they could get what they need to get out of the conference.
Yeah, I think you raise a good point, Maria. I think that sometimes we take for granted how much knowledge of this we have, and we can't go in and just say, all right, well, now we're going to have an FTC. That means family team conference, and here we go, right? So to really prep the families so they're aware of what's going to happen. I want to reframe, maybe I'll reframe my question. Any other thoughts about how we can prep our staff to use this model in the FTC process?
that in the supervisory review, in the case progression section, where it says like we're approaching an FTC period, make sure, you know what I mean? Like we need to sort of sometimes like really put it out there for everybody. At the FTC, make sure that you gain consensus on, you know, how dad's drinking impacts the family, or, you know, how to use appropriate discipline and the need for a plan around like you need to really spell it out, I think, in that part, because like it needs to thread, because the workers and the families are living in distractor land. Distractor is where they want to be. They don't want to be in the deal breaker. So like if we're putting that in the note, like in the FTC, focus on this, you know, it's just reiterating it. And then when we're reading the note, we're looking for that. Because if it's not there, then in that next meeting, like they really need to discuss that, like that might have been missed. And if the facilitators are also reading the supervisory note beforehand, you know, it's also a signal to them like, hey, I need to be getting consensus on these two areas.
Yeah, so the importance of the supervisory review, speaking the language in the supervisory review so everyone's on the same page about how to prepare, and then following up, right? It's up to the supervisor to read the FTC note and see how everything.
Yeah, I think start the conversation. Once it's on paper, it's in the supervisory note, like Justin was saying. So the facilitator will have it right here, the forefront. So you go in there and start having the conversation.
Yep.
With both clients and at time with case planners. Because sometimes case planners and the client, they are so enmeshed.
Yeah, the way I said it before, like, you know, they print our FTC facilitator after reading. She also prints the notes. She has it, you know, the last FAST, the last case review, you know, and also the discussion that we have, you know, she takes notes and she has it in front of her during the FTC.
Yeah. Let's shift our conversation a little bit. We're going to continue talking about staying organized, but we're going to talk a bit about documentation. Something I completely missed in our webinar last week was to talk a bit about the family discussion guide. So I'm going to share my screen. Bear with me for 1 second. What's going on here? Let's do it this way. And now I will do this great thing. Okay, so folks can see where it says family discussion here. Yes, nods, thumbs up are helpful. Great. So let's talk a bit about the family discussion guide. What is your expectation, supervisor, on how this is? Sorry, I'm like misplacing notes now. Bear with me for 1 second, sorry. So let's talk about the family discussion guide. So this is a document designed to help case planners with new assessments. Let's just go through it. Name, this is going to be who? Whose name goes here?
There should be the case name.
Yep, it's not the case planner's name, it's the case name, the case number. Next section, family members' names and ages, all pretty straightforward so far. Who might we include in this grid where it says family members' names and ages?
Whoever lives in the household.
Yes.
Yep. Who's in the household composition, the family composition. Then there's space for a genogram. Who's in the family and who are your resources? How many generations are in a genogram?
3.
3.
Right.
Yep. SBC is also very flexible on who we call family. I have an Aunt Joanne. There is no relation to this woman whatsoever, but my mom always knew if anything happened to her or my dad, Aunt Joanne could step in and help out. Conversely, maybe there are some blood relatives who we know can't step in and help out. So we want to be really mindful of this conversation about family and who belongs in the family. Beautiful. As we move down, we see the organization, like our little bubble organization. What's the benefit? We see it for family and for individual as well. What's the benefit of organizing things in this way instead of listing?
You can see it.
Mm-hmm.
Visible.
Mm-hmm.
It's not in your head.
Mm-hmm. Right.
And it separates it nicely, allowing not only to see it, but to identify what's working, what each individual or family needs to do. So
Right.
creating clear cut boundaries, so to speak.
Mm-hmm, mm-hmm, mm-hmm.
And then you can identify distractors, because people could, in the bubble, they could add some stuff that are distractors, some issues that are safety issues.
When we're writing in these bubbles, we start to create constellations of issues, right? Everyone knows what a constellation is. When we create these constellations, we're able to see that sometimes multiple problems are related to one issue. And it helps us focus in on planning around that one issue instead of creating a million outcomes for a million different versions of the exact same thing. It's a great tool to keep us organized. Coming in with a list of problems and saying, well, the family therapy, they'll do this, they have this, they'll do that. It's just not an effective way to work with families and move cases forward. Similarly, for the individual issues of concerns, we're narrowing it down to using our tracking to figure out how we are going to narrow this down to 1 or 2 individual level outcomes. I'm seeing some things perhaps in the chat, so let me. Okay, Waskar, no problem. I will send you this recording. The other piece, any questions about the family discussion guide?
Well, I think that this is something that we haven't been using, you know, and to be perfectly honest, it's because we have lots of documentations that has these similar things. So it feels like another thing with pieces of these other things.
Mm-hmm.
And part of, I think, the issue is that workers are already feeling overwhelmed with the amount of paperwork. And then here's another, you know, paper with these other things. And I think that we don't realize that we're doing some of this work in supervision. And what I personally think is important and useful is like the bubbling. Mm-hmm. And that's something that could be used. Whereas like these other things, like if we have a genogram and a genogram note, do we really want to ask folks to do that again? Is that like the best use of people's time? I don't think it is. But I think that that bubbling piece is like where we can help them sort it out in supervision so that they could help the family sort it out, mm-hmm. Right? I don't know how this is supposed to be used in SBC
land.
Yeah, I want to say pure moods. I don't know why. Like Anya's playing in the background. Like pure SBC this is a discussion with the family, correct? Mm-hmm. I don't know if in pandemic Zoom land that this makes the most sense for the work that we're doing with families. Because that's just, I'm just putting that out there because I think some parts of this are really useful, but the document as it is now probably made a lot more sense pre-pandemic.
So you may have just answered this question, but I just want to ask it for clarity. Are there pieces of the family discussion guide that do make sense in pandemic Zoom land?
I think you can use the form as a guide. Mm-hmm. I think you could truly use it as a guide and say, okay, you know what, here's this, let's, revisit, who is in your family. Let's revisit, what brought the family to us in the first place. Let's take apart what are the specific, individual concerns that are impacting this family. I think as a guide itself, I think it can be helpful. I think as another form to ask people to fill out, then I think it's going to be the kiss of death. I really do. Because we are document laden as is, so, but I think as a tool to use, as a framework, as a part of a conversation, it can be used. And even in supervision, I was modeling for my supervisees. I said, listen, I read your families. I read them. I say, I'm aware of them. I said, but walk me through this. So walk me through who is in the family. Right now, let's do this. And they had to literally map out for me, parent, caregivers, children, all of that. And I said, okay, so then let's look at, what specifically is the family level concern? What is it?
Mhm.
And, and that was very helpful with a case planner where she just had a meeting with ACS and the primary focus was on housing. And I was like, well, housing is a concern, don't get me wrong, because if people don't have a place to live or if it's overcrowding, that's a concern. But that's not the original reason what brought us to us in the first place. And that definitely wasn't the reason what brought ACS back into the family's life. So let's take this a step back. And through this conversation, it was able to help people actually see that. So I think that's where we can use this through our conversations. But I think saying to people, we want this additional form on top of it, I think is going to, I don't know, because we have this information in so many other places.
Mhm, mhm.
So, yeah. That sounds like a good idea to have it like as a guide.
Mhm.
Yeah, and I like what Robert said, because that makes it too rigid or something, more forms. So that it needs to be done more naturally is what we're thinking. Yeah, but we would have
That's
to
what-
really use that as a guide.
That's what I'm hearing. And the whole purpose of this is to help case planners get organized, right? This is the beginning assessment to get a clearer picture of a family. So if there are pieces from this that are helpful, I would say use them. And if this information, I'm not sure how to say this,
Gather all that information. and
Being
some of the
mindful you're
other
being
things
recorded.
lives in other
required to do.
places. Interesting. Okay. We could talk more about this. I want more clear guidance though.
I mean, I think they already doing this. I just like that this is all basically in 2 pages, because
Mhm.
they already doing the genogram separately. And then if things change, they have to go back and, to the genogram and change things or whatever. But they are doing all of this, but it's basically, a lot of, instead of this is a 1 or 2 page, they doing 10 pages.
Yeah.
That's how we do it, because, they have to do that from the beginning, or they have to add or take out if family composition changes or things like that. So, I mean, I like the form, but to add it, I think, it's too much. If it's just an addition.
The last thing we're going to talk about today before we wrap up is the family agreement, which is another form, sounds exactly like what everyone wants to talk about right now. So it's, similar, the top of it is very similar to the family discussion guide, client name, case number, the date that we went through this, family members, caretakers, relationship and their age. This is where we're going to start documenting the family level issues of concern, individual level issues. So what we did on the family discussion guide, we are concretely documenting. He reviews the guide as exactly what it is. It's a guide to help us sort out. Once we have done the sorting out, we move to the family agreement. There's a space for our distractors here too, because what our distractors to us are really heavy concerns for our families sometimes. Housing, you know, whatever your distractors are. So other issues that are important to the family, but not necessarily safety or high risk at this time. How are these issues impacting the family? Strengths, what we learned from our searching for exceptions, times things went well. Move into our tasks, what we're gonna do. And same thing for the individual.
Like an FTC.
Mm-hmm. This is all from the LMS. You will be able to do this for yourself from the LMS. I will admit something here. I meant to instruct you at this point to submit a family agreement before next week for comments and feedback. I'm not entirely clear on what that means, so I will follow up promptly with our SBC advisors to see exactly what they want from us. So I'll get back to you as soon as I can about that. For next week, there's the family agreement to address, and I just want to make sure that I'm telling you everything you need for next week. So module 3 is what folks should focus on for next week. Module 3 in the LMS, we're going to review that next week. We'll spend, similarly to this week, we're going to spend some time reviewing the course material from the LMS, and then we'll do a little more discussion of the skills and how they show up in supervision. Any confusion about anything we spoke about today? I think we had a good conversation about the FTC, how we're prepping our people to use this model in the FTC, the importance of tracking and staying focused, and how we use the skills to stay focused in both the work and in the FTC.
So Marie,
Yes.
I think the training that I took, right, the initial training, I think I can go back in there and go over it, right, for reinforcement.
That is a great question. Let me follow up with Natalie to see if she can extend your stay. See if you can get.
Right. Okay, thank you. Because the reason is, in order for me to be able to explain to the case planners, I have to really get an understanding on what I'm doing. So I would just like to go over it again, because I had the training years ago, but things might have changed. I don't know, but I need to reinforce myself. I got to be honest, so I can know how to do it.
I mean, I was able,
more than you can know.
I was able to do it. I did it actually during New Year's Eve, because you know how we got 93% score, and I was like, why am I getting 93%? It's, you know, I did everything. So basically I was supposed to log in through Internet Explorer instead of the other one in order to get that 93% to 100. So I was able to log in and I got the 100. So I don't know if you can do it, but I was able to log in and do it.
Okay.
Again.
So it just sounds like it would be helpful to have access to the material anyway, just so you can stay fresh on.
Afloat, yeah.
I hear you.
Up there, yeah.
Yeah. As someone who trains in the material but doesn't use it day to day, I know exactly what you mean. I go back and look at that initial course very often. Okay, let's stop recording.